Hi everyone, good morning. Welcome on into North Dakota today. As we prepare for cold temperatures, it's important to make sure that you and your loved ones are protected specifically from respiratory illnesses. Joining us in studio this morning, we have Dr. Hanson from Sanford to help us navigate as we approach cold and flu season. Good morning.
Thank you.
Welcome back.
Thank you. Cold and flu season sounds like kind of a dirty word right now.
Yeah, I know. Well, especially when it's 80 degrees and beautiful out today, huh?
I know. But unfortunately, I think the time is upon us.
The reality is setting in, but specifically we're talking about respiratory illnesses.
Yeah.
So first, to start things off, what is RSV? What does that stand for?
Yes.
And how does it occur?
Yeah, well, I think that's the one that a lot of people really think about, especially if they have young kids. RSV stands for respiratory syncytial virus, and it's a respiratory illness, so it causes congestion and cough and sometimes wheezing. It's very, very common. In fact, most kids catch RSV by the time they turn 2. So that gives you an idea of it's just out there and it's rampant. But it can be a bigger deal in little ones, particularly infants.
I feel like that's how I've heard of RSV. It's always with young children. And is that just because the symptoms are more extreme? Because anyone of any age could get it, right?
Yeah, in fact, people of all ages get it every year. But the very young and the very old, like a lot of infections, are just more prone to the serious complications. And in a baby, that might mean, you know, significantly difficulty breathing. So the labored breathing, they're gasping, their airways are plugged with mucus, and it turns out when you can't breathe, you can't eat very well, so you're at risk for dehydration. So really those younger infants can have some trouble. But in most kids it really is just, you know, kind of like a bad cold.
So do we need to take our children in immediately if we start seeing these kind of symptoms?
Yeah, I think really it just depends on how they're doing. So if your child's urine output is decreased and you're worried about dehydration, if their breathing is really labored, I would get that checked out. If they've got a fever that's lasting for longer than 3 or 4 days, you know, I think those would all be reasons to come in and get checked out. But otherwise, it's okay to use those good supportive measures at home.
Yeah. So how do we try to prevent this?
I mean, it's the same as a lot of our respiratory illnesses. Good hand washing, good sleep, good nutrition, stay home if you're sick. Yeah.
So what else are we kind of seeing out there right now? We kind of were talking right before we came to air. I mean, COVID, that whole new wave is back. A lot of people getting that.
Yeah, definitely a lot of cases of COVID out there, again, causing those respiratory symptoms. I'm working in the urgent care tonight, so we'll see what I see tonight. But over the past few weeks, there's definitely been some strep. There's been some stomach bugs, you know, causing vomiting and diarrhea, and then just other kind of typical colds.
So is this really, you know, kids are back in school, they're back in class, those same surfaces are all getting touched. It's kind of what happens at this time of year, yeah?
Every year like clockwork, you know, just a couple weeks after school starts, kids, you know, they're in close quarters, there's lots of them together, and that's when we really start to see an uptick in those infectious illnesses.
Okay, so what's our best bet moving forward so us parents can try to keep our households healthy?
Yeah, well, again, we recommend those routine vaccines every year, both flu and COVID vaccine. That good hand washing, really teach your kids about how to make sure they're doing really efficient but effective hand washing. Teach them to cough into the elbow so they're not spewing their germs everywhere. It's just a lot of those basic things that we've known for a long time.
Okay, and then how do we get a hold of you if we need to come in?
Yeah, well, you can check out our website, www.sanfordhealth.org, or you can call our pediatrics clinic at 701-234-3620.
Okay, anything else our viewers need to know this morning?
Giddy up, I think we're in for a rough winter, but hopefully we'll all stick together and make it through.
I like that. We're gonna all come together on this one in a very healthy, sanitized way. Huh? Well, thank you, Dr. Hanson. It's nice to have you back in studio. All right, stick around, everybody. Coming up on today's show, Apex Physical and Therapy and Wellness Center is celebrating 15 years. We'll tell you how after the break.